Hello, welcome to LuxDen, friends. Today I'm gonna talk to you about the implants and how it's been restored in our office. I specialized in implantology. That's my specialty and my passion. I am doing implants since 2003, so I'm doing implants for 15 years. I've done more than 3,000 implantations and restorations of difficult cases, simple cases in my office. So what is implantation, how it's done? Today's approach among contemporary implantologists is completely different than it was 5 or 10 years ago. So today we are approaching the implantation, which is called crown down techniques. What is done and how does it work for you? We begin to plan everything, not starting from the surgery and implant, but we're starting everything from crowns. We're planning how it's gonna look and where it's gonna be to give our patients the most ideal results, the most aesthetic, and make sure that it's gonna last for as long as possible, hopefully forever. So when you're in our office, first we're gonna start with exam. We'll check medical history, we'll check medications you're taking. We will try to check everything and minimize the risks. We're gonna give you medications, explain how to take it, and prepare you for the surgery. After that, we're gonna do a couple scans. First scans are usual X-ray, but for that scan we're using unusual machine which is called cone beam. That machine gonna give me and my colleagues is gonna give 3D view of the site of interest, and it help us to plan the surgery before we begin the surgery. Also, we're gonna use amazing technology which is called CEREC, and we're gonna scan with laser the point of the area of interest. And then what we're gonna do, we're gonna merge both information together. So we're gonna attach cone beam X-ray to a laser scan from CEREC, and it's gonna form one whole entity. After that, using special software which is called Implant or Blue Sky Bio, sophisticated software that helps plan surgeries and implantations before we begin anything. We also have in the office 3D printer, and we're gonna use a 3D printer to print a surgical guide. Surgical guide is gonna transfer information from the software that I used to plan a surgery into a surgical field. Surgical guide is gonna be sterilized and it's gonna duplicate exact locations, depth and position of implants in the jawbone. During the surgery, we're gonna use a surgical guide to put in implants, and it's gonna be much faster with less complications and more predictability than if we're gonna restore and do the surgery without using that amazing technology now. After 3 to 6 months, when the implant integrates with the jawbone, then we're gonna do a second surgery, open the implant and put healing abutment which is gonna form the gum. We wait from 3 to 4 weeks depending on the case, and after that time we're gonna take impression and fabricate the wonderful crown. This is gonna serve, feel and function like your own tooth. As for crowns, we have multiple choices depending on the situations. We have porcelain fused to metal crowns, PFMs. We have zirconia crowns. We have zirconia crowns with feldspathic porcelain on top of it. We have IMEX crown, which is lithium disilicate, wonderful aesthetic material, really strong. And we have multiple other options, which we're gonna talk to you about it and choose the best option to restore the implant. Also, we can choose from options of abutments. Abutments can be prefabricated, which it means that it's done on a factory, or it can be custom-made, which is done here in the office on premises. Custom-made abutments can be either from metal, or it can be from zirconia or other kind of ceramics. If we need strength, we're gonna use metal abutment, custom abutment. If we need aesthetics, like in the smile zone and the front teeth, then we're gonna use ceramics. We're gonna use ceramic abutments to give unparalleled beauty to the patient's smile. So that's how we're doing things here. And if need arises, please come to LuxDen so we can help you with your dental needs.